the awesome Community Health Committee, or CHC. My name's Karen Hansen. This summer will be my third trip with YouthLink on this committee. My training is that of a pediatrician and child abuse pediatrician. The CHC's purpose or goal is to improve the health and well-being of the community in sustainable ways by teaching about basic health and hygiene. We're so lucky because education really works. Knowledge of simple things can prevent disease, and knowledge is sustainable. I need to mention that YouthLink does not provide medical clinics for the villagers, primarily because this would not be sustainable. Here's what we generally do. We do health lessons, health-related projects. We collaborate with other committees when indicated. An example might be collaboration with the Cultural Committee, who does a mural for each village. Maybe we would want to put some health-related information into that mural. Before we leave country, usually in the spring, our committee puts together a lesson for the team about health issues in our respective countries. Usually a humanitarian on the committee researches this and gives a 10-minute presentation. Here are classic, time-honored CHC activities, and we'll go through each one in turn. First, health lessons, kind of the core of what we do. I like to divide them into basic and advanced. Basic ones are taught in English and STEM camp, more on that in a minute. They're for elementary age, sometimes young adolescents. Advanced health lessons can be taught at a health fair if you put one on. They can be taught in many small group situations and are for older adolescents and adults. Just a word on English STEM Camp for those who have not worked with YouthLink before. This is organized by the English Committee. The camp is for school children and occurs almost daily or often daily in the village, often at a school. And for this camp, every team member develops a lesson and teaches it in camp one time. So we have the advantage of being able to do our English STEM camp lessons as basic health topics. And that's great for us. Basic health lessons are supposed to be fun, interactive, and simple. I would aim at 10 to 15 minutes, so the English committee may direct us differently. And then you can repeat it once. You need to bring everything with you, any props or materials that you want. And remember, repetition is valuable. I always worried that the school kids may have learned the same things in school, but if they did, you're still probably going to teach them a thing or two. It'll help them remember, and they can show off a little bit about what they do know. I also think the children can bring the basic health information home to the parents and remind them. Here's one of the more popular basic health lessons that people do. Every committee member brings a pillowcase down, a white one with a hole cut in the top, and the kids dress up as teeth. Then a couple of other kids get a rope and clean between the teeth in the way of proper flossing. So here is a list of basic health lesson topics that you might want to use. Please notice the other. There's lots of room here. An example, in a recent Guatemala trip, one of the humanitarians was fluent in sign language, and she did that for her basic health lesson, and the kids just loved it. Advanced health lessons are for older adolescents and adults. I would aim at 15 to 20 minutes, and each committee member will do one or two of these depending on the size of your committee and what you want to do. These should aim at what is important, what the villagers are interested in, and what you are interested in. Demonstration and practice sessions are great for these. You can see in the slide, they're demonstrating the old Heimlich maneuver, so-called, that is used to treat choking. Learner interaction is great, and posters can be very helpful. I would make one for your talk. It can guide you as you go, provides a visual background, and you should consider laminating it to leave it behind to remind the villagers what you taught them. There are 2 pages of suggestions for advanced health lesson topics. Please note that you can teach more advanced versions of the basic health lessons if indicated in your village and other. There is always room for what you want to do. I had some concerns about the health lessons at the beginning. I just worried that YouthLink had been in the village I was going to the year before or years before. Was I going to just teach the same old lesson all over again? If you can get the information, you don't need to teach it again. But if you can't get it and you do teach it again, really, I do think repetition is okay. How much can any of us be expected to learn from a lesson? And the real concern is that the villagers may be more advanced now than when these projects were started by YouthLink many years ago. So you can address these concerns by learning things about your villagers before planning your topics. What is their current knowledge base? What do they have access to? A simple example. What if you want to put together a nice advanced lesson about prenatal care and pregnancy? What if they have a clinic, maybe only a half an hour or an hour away, and all the babies in the village are delivered there, and there's also prenatal classes? Pregnancy is probably not your best choice. Then of course you need to know what they want to learn about, and you need to know what strict restrictions you might have. For example, in some countries, you can't talk about birth control or sexual matters, especially in mixed groups of men and women. So to get this information, here are some resources. The best is information from your current in-country coordinator through your team leader. And they are supposed to know and be familiar with your village. The problem with this is it takes time. The committee resource page has a list of questions you can look at and ask and add to. Then next, the Community Health Committee Manual, which we're currently rewriting, so you'll have to keep that in mind. It's also on the committee resource page. There are written summaries from past CHC mentors at your site. You need to ask your team leader for these. You also ask your team leader about contact info for past CHC mentors so you can call them. And this is particularly valuable. Next, looking at classic CHC activities, the health fair. This is a time-honored tradition, and it's a lot of fun, but it has some disadvantages. If you do one, you're in charge of it. This is a CHC activity. It's for adults and older teens, and it is one venue to teach advanced health lessons. The fun part is that it becomes a real village event. The downside is it can be kind of chaotic. It usually takes about a half day, 2 to 3 hours, and village leaders will designate where your fair is going to be. You want a large area with access to smaller areas for breakout sessions, and try to find out what's available where you're going to have the fair. For example, if they have chalkboards or whiteboards, you don't have to haul paper down to write on for your visual demonstration. Your in-country coordinator can provide an estimate about how many villagers may attend. And that's very helpful to you. All these questions are on that sheet that I told you about on the committee resource page. So often the fair is organized into a general session and breakout sessions. Demonstrations and practice sessions are helpful, but not always practical. The picture shows an outdoor health fair that is really jam-packed with villagers, and practice sessions just are not going to work there. So that's one of the downsides of the health fair. When I first started being involved in this, I just couldn't imagine what a health fair would look like. So here's a sample. You have perhaps a general session to start. It takes about an hour. You present 3 15 to 20-minute advanced lessons applicable in general to everybody. You take a break. Then you reassemble into breakout groups. Often these are men's and women's groups, but they don't have to be. They could be small groups for lessons that require demonstration and practice. Then in the breakout groups, each one gets 2 15 to 20-minute lessons applicable to their group. And then a question and answer session, which is lots of fun because the villagers tend to warm up to you in these smaller groups and ask questions. This adds up to 7 separate lessons and a 2-hour and 15-minute fair. If you have a large committee, those who aren't teaching at a particular time can help out those who are. Looking again at the CHC project's Days for Girls kits. This has an interesting history. A woman volunteer in Kenya many years ago noticed that the girls were not coming, the village girls were not coming to their school on the days they had their periods. And that was because they had no way to control the flow. They had to stay home and use whatever was available, like leaves or paper or old cloths. So she didn't like that. She wanted the village girls to attend school. And she put together a kit with reusable menstrual pads as the main item, extra underwear, things like that, and found that this was a lifesaver if the village girls and women did not have access to modern materials, which back then they never did. And her organization has grown, and there are offices in several international sites. For us, Guatemala, Kenya, Nepal, and maybe Cambodia, it's developing there, have sites. And you can buy your Days for Girls kits if you want to do Days for Girls kits there to help them out. Otherwise, your team leader can help you find them locally. And if you decide to do Days for Girls, a committee member will need to take their training. I don't think it's very involved. It's on their website right here. And here's their motto also. She's got this, we've got her, period. Moving on with classic activities and projects, cycle bead bracelets. And these are bracelets where the colors of the beads indicate the stage of the menstrual cycle. And there's a little device on it that the girls move around a bead at a time per day. And it's very helpful in predicting when to expect your period and when to avoid sex to prevent pregnancy, if you can talk about that. So that's why you need to be culturally sensitive. I think these are so pretty. And when all the girls and women of the appropriate age are wearing them, there's no stigma with them. And I think it gives a sense of community for girls and women in the village. So there they are again. If you're going to do cycle beads, you have to use this as a more advanced health lesson topic. And directions for their assembly, there's a video on the YouthLink website and on lots of sites on the internet. How to distribute them. The easiest way to do this is to assemble these at home here in the United States at an extra committee meeting before you leave, and then haul them down and then distribute them at a special women's meeting that you organize, or at a women's breakout session at the health fair if you're doing one. Or you can bring the materials down with you and have the village girls and women assemble them at a special meeting that you organize. That's a lot of fun, but it's sometimes hard to organize. Either way, you have to teach your health lesson about cycle beads when you distribute them. Next, going along with classic CHC activities, hygiene and first aid kits. So here's a list of the materials that you could include if you decide to do these. If you do them, some of your lessons should teach about how to use the items in the kit. Now you can assemble these in an extra committee meeting before leaving, or you can assemble them in country. Ask your in-country coordinator how many are needed and do what you can. You may not be able to produce enough. For a middle to large size village, 100 kits seems to work okay. Traditionally, these are handed out at the health fair. I would recommend not doing that. Some villagers may attend the fair only to get the free stuff. There may be jealousy problems that arise. I would ask the village leaders to hand them out at a separate time. I also wonder how sustainable these are. There are certainly sustainability aspects. For example, introducing the villagers to good hygiene practices, but certainly the materials in the kit are probably not sustainable. If you're going to do them, try to buy some supplies in country. Donations are great. The dentists are so generous with giving you those kits that have a toothbrush and toothpaste and dental floss. that you get when you get your teeth cleaned. And then Globus Relief and Mandalay International have offices here in Salt Lake where you can buy things very cheaply. So last on the classic CHC activities, medical supplies. Work with your in-country coordinator through your team leader to find out what is needed. Maybe the clinic that's associated with your village, if there is one, needs something. For example, the Fiji team last summer found that their clinic needed to have glucometers because they were seeing lots of patients with diabetes. Maybe the village school needs a simple first aid kit so they can treat minor injuries on site. You'll need to be sure they know how. Then donated supplies, hospitals, clinics, drugstores will give you things. Often these things are expired, but perfectly good. Just be careful. Some in-country clinics can't accept expired items because of their licensing agreements. An example is Peru. So those are the classics. There are lots of other things you could do, and here are some ideas. I strongly recommend scheduling a few half days each week that you are in your village to teach small groups of families using your lessons. I mean, not everybody gets to go to the health fair. You could do this instead of the health fair or in addition to it. Arrange to go to an area school to share your health lessons with children and adolescents who are not just from your village. Find out which families do not have access to clean water in your village, and instead of using your resources to buy hygiene kits, purchase simple water filtration devices for them, and then as a committee, deliver them to the homes and teach them how to use them. You could lead an informal stress reduction or yoga class in the village. And my favorite, you could identify a core group of villagers interested in health and focus on teaching them the basics with the expectation that they will teach the village families over time. And that one's not been tried, but I think it might work well. In the end, what you do is up to you and the needs of your village. One thing you don't want to skip, though, is a visit to a local clinic. This can be so fun and informative, and these pictures are of a visit to the clinic that goes with the Peru villages that we tend to visit. Anyway, it may not be realistic, but check with your team leader to see. So primarily to all the CHC leaders, at the beginning, I just found all this information overwhelming and confusing. I mean, maybe it's clear to you, but it was not to me. Ways to get by that: read through the committee manual, remembering it's being revised right now. And you can read through these slides again, kind of study them more than just listening to them. There's a choice where you can do that without having to listen to me. They're on the committee resource page. And most importantly, please get hold of me with any questions that you might have. I recently retired, so I have lots of time to talk to people. Thank you for listening.